Once again, thank you, everyone, for joining us on this evening for World AIDS Day. It is nationally recognized on December 1st of every year. And today we'll just have a conversation about HIV, AIDS, and how we as the community can reduce the rates, and understand the stigma and increase sexual health awareness in our community. At this moment, I will have our president of Concord Alumni Chapter give us greetings at this moment.
Great evening, and thank you all again for joining us. This day creates an opportunity for all of us worldwide to come together in the fight against HIV. It is our responsibility to show support for people living with HIV and make them all feel included. The commemoration of this day is also to remember those, and for some of us, loved ones who have passed from AIDS-related illnesses. We thank each of you again for what I am sure is going to be an engaging and enlightening webinar discussion this evening, designed to spark thoughts, increase awareness, foster comprehension, and motivate action in combating HIV/AIDS. Thank you to Sora Elaine for serving as our moderator. Thank you to our panelists, San Juan and Kiara of Rayo Community Health, and to our PP&D committee for your planning. Again, thank you all so very much for being here with us on this Friday evening, World AIDS Day. Sora Elaine, back to you.
Thank you so much, Madam President. At this moment, I will be introducing Kiara Washington and San Juan from the Rayo Community Health Center, and they will be presenting on the information today. And this will be an interactive session. We will have question and answer at the end, but they will request that you guys participate in the activities that they will be presenting with us today. Thank you.
Thank you guys for that wonderful introduction. We are really happy to be here today to talk about HIV, AIDS, and how you guys can help reduce rates and stigma in your community. So I am Kiara Washington. I am the Special Projects Coordinator at Rayo Community Health. I'm from Charleston, South Carolina.
Good evening, everyone. My name is San Juan Cappy Jr. I'm the HIV Testing Outreach Coordinator for Rayo Community Health. I'm a transplant from St. Louis, Missouri.
So I bet a lot of people are wondering what is Rayo Community Health? Who are we? So Rayo Community Health is a 501c3 nonprofit organization in the Charlotte area, and we provide medical, social, mental health education to minority and underserved communities. We also do some work in Cabarrus County as well. So we offer an array of services and programs to the community, including HIV and STI testing and PrEP enrollment. We do Hopwa housing for those living with HIV. We have a CLEAR program, which is Choosing Life Empowerment Actions and Results, which is a program for those living with HIV. We have a lot of health equity initiatives around reducing chronic illnesses like heart disease, high cholesterol, diabetes in African American communities. We have medical services, we have a walk-in clinic, and we have an on-site pharmacy. So this slide is just talking about what World AIDS Day is and what the theme this year is. So World AIDS Day is an opportunity to reflect on the progress made, raise awareness about challenges that remain to achieve ending the epidemic by 2030, and mobilize stakeholders to redouble efforts to ensure the success of HIV response. This year in the United States, the theme is Remember and Commit. So this theme is an opportunity to reflect on the progress that has been collectively made with partners and to commit to the actions needed to end the HIV and AIDS epidemic as a public health threat by 2030. I'm going to pass this to San Juan.
All right, everyone, let's test your knowledge. Usually we do this in person. It's my first time doing this on Zoom. Hopefully those of you in attendance can participate in the chat. and we can test your knowledge as it relates to HIV and STI. Next slide, please. First, let's go over some keywords and definitions. Does anyone know what HIV stands for? First person to put it in the chat is the winner. Don't be shy. All right, LaShawn Kelly, you got it. Human immunodeficiency virus. Thank you. Does anyone know what AIDS stands for? Crystal, you got it correct as well. AIDS is acquired immunodeficiency virus. Can anybody tell me what the word STI means? Sexually transmitted infections. You all are on this. Good job. And that includes syphilis, infections, chlamydia, gonorrhea, tricks, and so on. They were formerly called STDs, which were sexually transmitted diseases. We like to use the word STI because STD stigmatizes an infection. So we don't try to categorize anyone as being worse, or like, you know, some people are stigmatized for having, you can get chlamydia and gonorrhea and it can be treated, and people feel that people who have HIV, herpes, or HPV, they categorize them in a lower range, and we try to fight that stigma. Next, does anyone know what HPV stands for? Look at y'all on it. We got some valedictorians in here. Human papillomavirus virus, correct. And it causes genital warts and some cancers. Is anyone familiar with the word PrEP? PrEP is post-prophylaxis, pre-exposure prophylaxis, which is, I'll get into detail with that later. I don't want to jump the gun. And you're correct, Rosemary. It helps protect you from contacting HIV if you take it properly, correct? Has anyone ever heard of PEP, P-E-P? All right, so PEP is something I really want you all to pay attention to. It's post-exposure prophylaxis, and I'll get into detail on that one later as well.
Okay.
Now we're going to play a game, true or false. You can put your answers in the chat. Just testing your awareness on this. Number one, having HIV and AIDS is basically the same thing. True or false? Good job. Good job. Good job.
So after each one, we are going to tell you guys why this is false or why this is true. So for this one, there are 3 stages of HIV. The first one is going to be acute HIV infection. The second is going to be a chronic HIV infection. And the third is going to be acquired immunodeficiency syndrome, which is AIDS. And that is the last stage of HIV. When taken as prescribed, medicine for HIV, which is antiretroviral therapy or ART, helps people at all stages of the disease, and treatment can slow or prevent progression from one stage to the next.
Thank you. Being diagnosed with HIV is no longer a death sentence. True or false? Good job. Look at y'all.
Yes, that is true. So before the introduction of ART in the mid 1990s, people with HIV could progress to AIDS in just a few years. Today, with proper medical care, HIV is very manageable and can be controlled. People living with HIV who take their medication as prescribed and make other healthy choices can live a long and healthy life.
Medication can reduce the amount of HIV in the blood of someone who is HIV positive, making them undetectable. U equals U. Untransmittable equals undetectable. True or false? Good job.
Yes, so that is also true. So, like we stated previously, if those living with HIV take their R as prescribed, their viral load, which is the amount of HIV that is found in their blood, can become undetectable. If it stays undetectable, they can live long and healthy lives and effectively have no risk of transmitting HIV to their sexual partners, which is what U equals U stands for.
Number 4, Black African American men and women have the highest rate of newly diagnosed HIV infections in Caribou County. You all are correct.
Yes, so that is true. That is true for Cabarrus County and Mecklenburg. So we are in Mecklenburg County, but we do service those in Cabarrus as well. So in between 2010 and 2020, Black and African Americans had a diagnosis rate of 25.1 per 100,000 people, compared to white people who had a diagnosis rate of 2.44 in Cabarrus County when we're talking about HIV. So that is a huge difference and a big disparity between African Americans and white people.
Number 5, Black African American men and women had the lowest chlamydia and gonorrhea rates in North Carolina. True or false? Listen, y'all passing all the tests.
Yes, so that is false. So in 2021, Black and African American men and women accounted for 39% of chlamydia cases in North Carolina and over 50% of gonorrhea cases. African American, both men and women, accounted for over 50% of new STI cases, as the data reported that races. Oh, okay, yeah. So they accounted for over 50% of new STI cases in North Carolina as well.
Number 6, HIV can be transmitted by close or casual contact with someone with HIV. I'm loving this generation. Y'all on it.
Yes, so that is false. So HIV cannot be transmitted via hugging, using the same toilet, drinking from the same straw. HIV can only be transmitted via 3 bodily fluids, which is going to include blood, secretions from the anus, vagina, or penis, and breast milk. So this is my slide. So these are some figures from North Carolina. So on the left, you guys can see the bar chart is about the age distribution of newly diagnosed HIV cases among adult and adolescents 13 years or older by gender in 2021. So if you can see between the ages of 20 and 24, they have the biggest incidence cases in North Carolina pertaining to newly diagnosed HIV cases, with men having a higher rate, but transgender having the highest rate. And then on the right, we see the bar graph or the line graph is newly diagnosed HIV rates among adults by race. So the blue line at the top is going to be Black and African Americans. So in North Carolina as a whole, the rate of HIV in 2021 was 43.5% compared to Hispanics who had a rate of 26.9. And then, of course, whites are at the bottom with 5.3. So as you can see, the minorities have a way higher incidence rate of getting HIV versus the white population in North Carolina specifically. And this slide, I did find this picture, which is a HIV diagnosis rate by county from 2010 to 2020. So the dark county in the middle is going to be Mecklenburg County. So of course, Mecklenburg County has the highest, one of the highest incidence rates of HIV. And we have 26.9 per 100,000 population. And the one that is highlighted and has like the dark outline is going to be Cabarrus County. So Cabarrus County actually has a rate of 8.2 per 100,000. So it is less than Mecklenburg, but due to the amount of people that live in Cabarrus County, that is why, but it's still not where we want it to be.
All right,
Okay.
HIV STI 101. As you can see here on the chart, this is the rate of transmission for each STI infection. Starting at the top is HIV, then we go below is HPV, chlamydia, gonorrhea, syphilis, trich, genital herpes, hep A, B, and C. And the rate of transmission for each and every one of these is check mark here, which means you can contact these through sex, okay? If you move to the next category, it's going to be blood, needle sharing works, or piercing and tattoos. Most of the time, people get these infections when they're not in a public setting, such as a professional tattoo shop and professional piercing being done properly. A lot of people contact these STIs in prison, or what we call basement tattoos, or sharing drug equipment, shared works when people get high. In the next category, you can see which STIs you can get from casual contact. And this is the neat thing that a lot of people, I'm sorry for using that word neat, but this is what's very powerful, because a lot of people think that an STI is from somebody having oral sex, vaginal sex, or anal sex. And you can just have casual contact with a partner. And if there's an exposure and you rub your skin with their skin, such as you see here where the HPV is check marked, or excuse me, these are showing how you can get these infections, even though it's not like having sex. So anything check mark is just casual contact, kissing, hugging, skin to skin. The next one is contamination of food or drink. The only one that you can get there is hepatitis A. Hepatitis A, if you were to contact that virus, you would have it for like 6 months. You'd be extremely sick for quite some time. You'd have flu-like symptoms, diarrhea, etc., abdominal pain, nauseousness, and you really wouldn't even know that you had been infected with hepatitis A from someone preparing food, who uses the restroom, who has fecal matter on their hands, they haven't properly washed their hands properly, and they served their family members, or even in a restaurant, that food, you've ingested it and you don't know why you're sick. You think it's food poisoning, and you've contacted hepatitis A. What is unique about hepatitis A is that once you catch hepatitis A, your body makes an immunity after the fact, and you will have resistance to catching hepatitis A again. And last but not least, what we call vertical transmission, which is from mother to child, breast milk, birth, etc., is how you can catch HPV, HIV, chlamydia, gonorrhea, syphilis, genital herpes, hepatitis B and C. A lot of the times when someone has herpes 2, which is below the belt, like downstairs, most of those women are advised to have a C-section. Next slide, please. And these are the symptoms of HIV, HPV, chlamydia, gonorrhea, and syphilis. Painful urination, you will see, is going to be with the chlamydia and gonorrhea. There's going to be a foul odor and discharge as well with chlamydia, gonorrhea. If you notice, HIV, HPV, and syphilis is under the radar. So you can have these, you can be asymptomatic, have this virus or this infection, and not even be aware of it because you're not getting the signs and symptoms. HPV has the painless warts or lumps around the genital areas. There will be vaginal bleeding in between periods, or urination for men and women who have chlamydia and gonorrhea. A lot of times I work in the clinic, people come in and they have like a foul odor, discharge, a burning sensation. There's like a throbbing sensation in their throat for people who do oral, and that's a pharyngeal swab. We'll swab your throat, put this in a specimen container, send it to LabCorp. 3 business days later, I get that result, and there's been a lot of gonorrhea orally, because you can get it in any orifices that you use sexually, okay? So don't think that just because you do oral on somebody and then you put the condom on and then you have penile to vaginal or whatever type of sex that you're having, you still have that area that's been contaminated. So I try to teach people. A lot of men come into our office and I don't like to use the word download. They can't be their true selves, because in the Black community, we judge one another harshly due to religious views or the way we were brought up. And a lot of people do things on they call them sneaky links or whatever. But anyways, if that person was to do something and he did anal with a transgender woman and she topped him, and he came to see me because he's having signs and symptoms and something's going on, and he urinates in a cup, but he didn't use his penis, the chlamydia and gonorrhea is going to be on his backside, and that test will go undiagnosed and come back negative because he didn't swab his anus. And it's hard. I've seen a lot of Black men come in struggling to tell their truth, and the longer that you let something go like that, it can cause a lot of damage to you. As we see HIV, there can be severe weight loss with that one, as well as with syphilis. Swollen lymph nodes here or wherever your lymph nodes are underneath your armpit. We have them all over our body. So to each their own. HIV will give you a rash, and syphilis, the first sign of syphilis usually is a rash. There's 3 stages to syphilis as well. The first one is going to be like a rash. Then you'll have a canker sore that appears where the site of the port of entry infection happened at. So it can be on your genital area. It can be anywhere in your body. It'll look like a pimple that you popped on your face. It'll look like a canker volcano. It's painless. It'll look really painful to the naked eye, and you can touch it and the person will feel no pain whatsoever. So that's the secondary stage of syphilis. And you'll see on some people, they'll have these black little dots on their hands and feet. And the last stage is when it gets into your brain, and it's bad if it gets that far. Yeast infections are common with HIV, thrush and things of that nature in the mouth. HIV does do temperature changes with people because it elevates your body and throws everything off because your body is fighting a serious virus, and everything goes into attack mode, as well as with syphilis as well. Next slide, please. And as you see here, these are the signs and symptoms for trich, genital herpes, hepatitis A, B, and C. Again, there's painful urination with trich and with genital herpes. Dark stool would be with hepatitis A, B, and C. There's a foul discharge with genital herpes and trich for the both of these 2 spots here. Can you see my mouse when I do this? No? Okay, I'm sorry. So anyways, pain and itching or burning around the genital area is going to be on trich and genital herpes. Vaginal bleeding between periods is going to be with genital herpes as well. Painful intercourse is going to be with trich, genital herpes. And you'll see small bumps and blisters that come to the surface for somebody who's infected with genital herpes. So you have herpes 1 and herpes 2. Herpes 1 is upstairs, it's oral herpes. Some people are born with oral herpes through vertical transmission of the birth. And then like I've seen babies come into the clinic because family members, when somebody has a newborn, they're like, oh my God, my niece and nephew's so cute. And they pick the feet up and they kiss the baby's foot out of love, not knowing that they have that abrasion that's about to surface. And when that's happening, that point of contact where it's touched that baby's going to have herpes on the point of contact. Or if you were to kiss your partner or to suck on their neck or whatever body part you touch that person on and that bubble busts, it's going to be the skin-to-skin contact where that person will have that infection. I don't let anybody kiss my son in his face, including myself. I kiss him on top of his head. My mother, my aunt, my grandmother have that permission because I've seen things that really have frightened me from allowing people to do that type of stuff. Next, we have jaundice, which is going to be with your hepatitis. So that's going to be an infection in the liver. And when your liver is the only organ that can replenish itself, once you treat that virus or once that virus has been passed through, you can, there's treatment now for hepatitis C. You'll take medication for 3 months and you can be cured for hepatitis C. But if you were to use a dirty needle behind somebody or have unprotected sex and get that fecal matter back that's exposed to hepatitis C, you can be reinfected again. HIV dies not long after it hits the surface of any type of table, floor, or any type of setting like that. Hepatitis C can live up to 7 days to 14 days inside of a restroom, even a toilet top, any type of tissue that you use. So be mindful if you're driving somewhere out of town and you go to one of those rest stops to sanitize that toilet. If you have to sit on it, usually I do my best to stand up, and I teach my son how to do that. And I carry baby wipes and sanitizer wipes and things of that nature that will kill that exposure of infection. And last but not least, things that give you a fever and muscle pains are going to be genital herpes, hepatitis A, B, and C as well. Next slide. So the CDC recommends that people who are vulnerable populations get tested every 3 months. People who are vulnerable populations of focus that we consider are people who are sex workers or have multiple sex partners, people who use IV drugs, men who have sex with men, and people who regularly have contacts with getting STI infections. If you don't use condoms and things of that nature, we recommend that you get tested every 3 months. But the CDC recommends at least twice a year, every 6 months, for people who may live outside of that category. And at Rayo Community Health, we don't judge anyone. We treat everyone evenly. I support people who do sex work. I just try to teach them how to do harm reduction when they participate in those type of activities. And at Rayo Community Health, we do rapid testing. We have 4th generation tests. If you were to walk into my office today to do a test with me, you'd walk out that door within 20 minutes or less, and you would know your status for HIV, hepatitis C, and syphilis. As a phlebotomist, I would draw your blood, and I would send that sample to LabCorp. I have your urine, blood test results, and your mouth swab, which would be an oral pharyngeal, or rectal swab, which would be an anal swab. Within 3 business days, if it came back positive, we can treat you for that STI infection. We also have at-home tests for people who want to test in the comfort of their own home. And you can also test for HIV, these other STIs, through a spinal tap, which is not done. It's a very expensive test. People who are having huge procedures in the hospital sometimes get a spinal tap. The only thing I dislike about taking a home test is if that person is not in their right mind and they read that test and it comes back positive. If they're not mentally stable, they can cause self-harm to themselves or to the partner who they associated that positive test result with. Next slide.
Okay, I'm going to go over the treatment portion. So we talked about the symptoms of these STIs. So now I'm going to talk about treatment. So in the first column, we show if they are curable or not. And I'm going to use that word very loosely because people can get reinfected depending on the situation. So STIs that can be cured with antibiotics include chlamydia, gonorrhea, and syphilis and trich. So with these 4 in particular, you can cure them with antibiotics. With syphilis, you may remain detectable for many years after the infection is gone. So syphilis can still be inside of your bloodstream after you are already cured. So you can still test positive for syphilis even though you don't have it anymore. It'll just remain in your bloodstream. That differs based on the individual. And then with hepatitis C, so you can use DAAs, which are direct acting antiviral medication, and those are used to treat and cure HCV, and they help fight HCV. For HIV, you can use PEP, which we did mention earlier, which is post-exposure prophylaxis, and ART. So PEP is used after someone has an encounter and they think they may have come in contact with HIV. So PEP is used, trigger warning, I guess. Well, for rape victims, they use PEP a lot. So if you're ever in a traumatic situation like that, you can go to the physician or go to the emergency room and they will prescribe you PEP. And then for ART, those living with HIV, they use ART to keep their viral load down and become virally suppressed so that they can't transmit HIV. For HPV, you cannot cure it, but prescription medication can be used to treat the warts, and also a vaccine is used to prevent HPV and to also prevent the cancer that comes along with HPV sometimes. And then genital herpes, that can be treated with antiviral medications. You'll always have herpes, but the symptoms, the warts that come along or the sores that come along with herpes can be treated with the medications. And then for Hep A, there is no specific treatment, so it's not curable, but your body will clear hepatitis A on its own. In most cases, hepatitis A, the liver heals within 6 months with no lasting damage. So there's no cure. Your body kind of fights it off by itself. And almost the same with Hep B. Chronic cases may need antiviral medications and possibly a liver transplant. There's no cure, but most infections go away in 4 to 8 weeks. Next slide, please. So this slide, we're going to, the number one is gone. Okay. So for this one, we're going to talk about methods of HIV and STI prevention. So I'm just going to ask you guys a question if you guys want to put it in the chat. So what is the only 100% preventative method for contracting HIV and other STIs? So what is the only 100% way you won't get HIV or a STI? Yes, it is abstinence. So, next slide, please. So that is abstaining from sex. That includes anal sex, vaginal sex, and oral sex. I know a lot of times when we go to colleges and speak to students, they always think that abstinence is just anal and vaginal, but it does include oral because some STIs can be transmitted through oral sex. So next I'm going to ask, what is a common barrier method used to reduce your risk of contracting HIV and STIs? Yes. So it is condoms. So we're talking about latex condoms, but there are other types of condoms that reduce people's risk of getting HIV and other STIs. So internal condoms, also known as the female condoms, and then also non-latex condoms if you're allergic to latex, which is lambskin and polyurethane. So what is the name of the medication used to prevent HIV that we touched on briefly in the beginning? Close. Yes, PrEP. So PrEP, which is pre-exposure prophylaxis, is going to reduce your risk of getting HIV significantly if you take your medication or you adhere to getting your shot. Now they have injectable. So if you adhere to your medication orally or you adhere to your injectable, you can reduce your risk of getting HIV significantly. And then the last question that I have is there are 2 STIs, which is HPV and Hep B, that can be prevented by getting a what? Yes, it is vaccine. So there is a vaccine for HPV and Hep B that I mentioned earlier. So the vaccine for HPV prevents certain strains of HPV and reduces your risk of getting cervical cancer by 90%. So a lot of people I see that they're pushing the HPV vaccine a lot nowadays because there is a rise in certain cancers that are stemming from HPV. So that is very important to know. And next slide, please.
All right, PrEP. Again, PrEP stands for pre-exposure prophylaxis and is a medication that is used to reduce your chances of getting HIV from injecting drugs or sex. There's different types of PrEP. You can take Truvada, people at risk through people at risk through injecting drugs or sex. Then we have Descovy, people at risk through sex, not for people assigned female at birth who are at risk of HIV. And the reason why is that Descovy doesn't, the vaginal fluids don't allow Descovy to work properly at this time. They're doing studies on it. They never did studies on women when they produced this medicine. It was only men. But if a woman was only to do anal, and I'm just teaching you guys this because I'm very honest and thorough with my work, if she's only doing anal, she can take Descovy and she would be protected from catching HIV. She took it properly. And then there's Aptitude, which is a shot that you get once every 2 months, and they'll shoot you in your mid glutes, which is above your cheeks, I guess, on the sides of them. The very first time you get your injection, you'll go in and see your physician. You'll have to go a month later and get that second injection. And after that, it's bi-monthly with a 2-week window. So that's for people who do not like taking medication daily. Next slide, please.
Okay, so these are just our references that we used. And then next slide, please. And this is our contact information. If anyone wants to take a picture of this slide, we do have social media. We have a website. Like Sanjuan mentioned earlier, we do free rapid COVID not COVID tests. Sorry, we do have free rapid COVID tests as well. I'm sorry, I'm over the COVID stuff as well. So we have free rapid COVID tests, but we also do free rapid testing for HIV and STIs, as well as we do blood draws for other STIs and then urine samples as well. So if you do come and get tested, or you know anyone that needs to get tested, they will get is it $15? A $15 gift card?
If they do a rapid test, they get a $15 gift card just for the very first encounter with our agency. After that, they would just be treated just like everyone else.
Yeah. So on the first time that you come, you can get $15, which is a good incentive to come get tested since you have to anyways. And then next slide, please. Okay, this is our question portion, but we do have 2 other resource slides. If you want to go to the next one, please. Yeah, so we have some HIV and STI testing locations. So of course we put us on here, but we put JCSU. We did this for JCSU, so that's why we put that there. But you can also go to your local health department and get tested. So I did put CHA, Cabarrus Health Alliance, on here because they do testing in Cabarrus County. And then also you can go to your primary care physician. And then the next slide talks about PrEP locations where you can get PrEP if that's what you're interested in. CHA also does that as well. You can speak to your primary care physician. And then this link that I have down here actually shows you all of the facilities that offer PrEP. But I would still call, or tell anyone who you know who wants to get on PrEP to call, just to ensure that they do offer PrEP and PrEP services there. And that is all. Thank you.
Okay, thank you. That was a lot of valuable information. A lot. I was asking questions. I was Googling a lot of stuff while you guys were speaking. At this moment, I will open up the floor for any questions that any of our attendees may have for you all.
Hi, this is Crystal. I do have a question, and this is just for everyone. You had mentioned that the rate for the new infections for HIV, and I think I even saw on the news recently about syphilis, that it's a epidemic here in the Charlotte area, but particularly the HIV. Sorry, I have a cough. So for HIV being high among African American community, what are your thoughts on why do you think that is? And I know you had mentioned like a lot of, clients that you see come into your clinic, being, living a secret life, maybe that they are a little shy about, telling everyone about. But outside of that, what do you attribute the high rate, why that is? Because I'm trying to figure that out. And and I'm just like, it'd be interesting to find out what everyone else thinks. Thank you.
Yeah, I could speak. Well, I can say like a little bit because I know you're going to come from a clinical standpoint, San Juan. So I'm going to come from a public health standpoint real quick. So when we're talking about access to care and how Black and African American people in the Charlotte area specifically, are displaced from resources anyway. And if we're talking about educational attainment, if we're talking about transportation access in general, I think that is one of the biggest factors. White people are, it's known that they have more access to resources. They have great insurance, they have great education, they have systems that kind of raise them to, go to the doctor and get checked out. And, if anything is wrong, they're going to the doctor. But Black people, I think we have some type of hesitancy with the medical. It's a lot of medical mistrust, which is, of course, valid, very much valid from all of the history that we have. So I think it's a combination of things: history, a lot of access issues, particularly in Charlotte. I know a lot of communities that, they have to take 3 buses just to go to the grocery store. So just imagine how hard it is for them to go see their primary care physician, if you know what I mean. So from that standpoint, it's a lot of social determinants of health, I think, that goes into that, as well as like historical context too.
And thank you, Kiara, for that. Another thing is that white people have way more riskier sex than Black people. I just found that out by training I took that was led by white women and men. And what I've learned is that people who have a primary health care physician, a lot of their information isn't reported to the health department on the state level. It used to did not until HIV and syphilis numbers started to increase. So sometimes those numbers aren't even documented or reported correctly through the physician if it's up to their choosing. So these numbers are what are actually reported because a lot of us don't have insurance, so we have to go into the health department or into community-based organization where we gather that information in the screen and we submit the results back to the county because that's how the state is funding our agency. And it was just neat to see how it all made sense because I'm like, why are we the ones being affected like this? And I know white people who get down and do way more. As a matter of fact, they said white people are having more promiscuous sex than Black people. And their numbers are high too, but like I said, if you have a primary care physician and your result comes back positive, they treat you for it, and it's in the shelter of that care system that they have there.
Wow.
Yes, and we didn't even go over the percentage of Black people that initiate PrEP versus white people. There are so many white people that are on PrEP. It's not looked at as taboo because they know that they're going to engage in risky sex. So they're getting these medications early. They're being adherent to this medication so that they can go and do what they want. But in our culture, it is very taboo to even talk about sex in the first place. So how can we expect people to go out and get these resources if we can't even have a conversation about sex? You know, it's very, it's a lot of different dynamics between Black and white people, honestly.
And if you pay attention, there's TV shows now where white women are telling their, I mean, I'm watching American Horror Story and the dude's going out of town. He's walking out the house and his wife says, honey, make sure you take your PrEP. Like she's totally okay with allowing him to do whatever it is that he's going to do while he's gone. And we don't have these kinds of conversations with our partners.
I have a question. With the individuals that come into the center, do they, I guess, do they ask for conversation starters? How do you start the conversation with your partner about sex or just in your circles? Because sex is taboo within our community. I don't want you to know what I'm doing in my bedroom, but how do we start those conversations so that we can reduce the numbers?
The neat thing is that my grandmother's she passed away in August, and I work in public health settings. And from the very first day of me getting hired, I've been doing this work 70 years plus now. I would go to my grandmother with a bag of condoms, knowing she ain't messing around with nobody, but just having a conversation with her, joking, telling her I love her, showing her how to use a female insertive condom and what lube is and what lip it's not lip balm. Kiara, unmute for me and help me real quick. I have it in my room. 1 second, I'm gonna show you something. It's dental dam, like different barriers of protection that you can use
Oh
to
yeah.
protect yourself if you wanted to have sex with somebody. And what I do is when I get my results, I screenshot everything, I share with my sexual network or whoever I'm with, and I ask them to do the same. And it's funny because a lot of people get mad if I screenshot my results that I get back and I send it to them, and I'm like, why are you mad? Like, you should be happy that I'm sharing this information with you. And that's how I get to do my red flags and be like, you know what, maybe this isn't a fit for me. But this is another barrier protection. If you want to do oral with somebody, you can wrap this around the penis, or you can place this over the vagina or the anus and you lick it. If you can't get access to dental dam, what they do in prison is use saran wrap or Glad bags, and that's good as well. It's not 100% efficient, but it's harm reduction. And that's what we need to do, is have these difficult conversations with our kids. And a lot of people in the Black community stigmatize and disown their children because they show signs of being LGBTQ plus, but you will have no clue the guys who hoop and play basketball or are the freaking captain of the football team are out here shooting people in the streets, selling dope and all that kind of stuff, who get down and dirty. You never know what you're raising. So if you have these civilized conversations that are healthy as your kids are growing up, or with your partner, and you being 100 with them and allowing them to be free, then you can make an informed decision of, hey, I can be open-minded enough to be with this person, or you can kindly exit stage left and be like, hey, this ain't a fit for me. And we don't have those kinds of conversations. So until we do, you never know what's going to happen. And you can be faithful to your partner. A lot of Black women, what hurts me the most is that I've seen a lot of Black women come into my agency who swear they're faithful. I'm not playing the devil's advocate. I don't know who's doing who or what's really going on, but you can be the faithful one. The man or the woman could be the faithful partner, and you're doing everything right by the book of God that you serve, and some harm can be brought home to you that you did not cause. So we need to start having these conversations and protecting ourselves. Like she was talking about that pill called PEP. If you had unprotected sex or you got drunk and had a wild night out, go to the emergency room, let them know what happened. They're going to prescribe you PEP. You take that for 28 days straight. You have 72 hours to get on PEP. And if that person had HIV, that medication is going to kill that virus to where you're not going to have it. There's another medication out now too that they're giving people who have sex. It's called Pep Oxy or OxyPep or whatever. And it's going to cure syphilis, gonorrhea, and syphilis. It's something new that the CDC has recommended men who have sex with men to get because they have the higher rates. But I'm telling y'all this now too, because you can go to the emergency room or your physician, ask them for that medication. Within 72 hours, you take that antibiotic for a week straight, and you will, even if that person had syphilis, gonorrhea, or chlamydia, you wouldn't have it because that medication is going to shield you from it because the antibiotics are working. It's you have your pre-exposure and you have your post-exposure. So this is post, after you've been exposed, is the medication that you would want to take to shield yourself from contacting that STI.
Gotcha.
Yeah.
Thank you for those that answer. There is one question in the chat. Is PrEP an expensive drug? Does it cause many side effects that would further discourage someone to take them?
It's
Yes,
very. Go ahead. Go ahead.
Oh, I was going to say San Juan can speak more on the side effects, but I do know that PEP is expensive. But there are a lot of programs around that for people who can't afford it. And if you don't have any insurance, then you do qualify for programs and you can get the medication low cost or for free.
At our agency, we can get that medication for you for free. Now, when you want to go to the injectable version of it, you do have to have insurance that's decent to have that covered. However, I know how to talk. All you got to do if you want to get on PrEP and your insurance is fighting it, but they're giving you the Truvada or the Descovy, tell your physician that you have a hard time swallowing that pill. And that is your doctor will be able to reword the reference back to the insurance company that you can't swallow that pill. And then your insurance has to approve that injection for you. So we have to learn how to maneuver our way through the system like we did. Y'all know the struggle. You just got to maneuver your system.
Okay. Then there's another question. Is the cure rate or treatment rate the same for pre and post treatment?
So for I can speak for PEP. It is 80% of the time effective. So it has an 80% accuracy rate for reducing the risk of HIV, but also it depends on when that person goes. Like your success rate is going to be significantly increased if you go to the emergency room like ASAP. You have to go within a window. So of course, after time, it's not going to work. And then for PrEP, it is over 90% effective.
Okay.
And I did see the comment about PrEP and how it is marketed. And yeah, we have a lot of conversations about that. PrEP is, I don't know if you guys have ever seen like commercials, but PrEP is always like two gay guys. Sometimes they're Black, sometimes they're white, but like we're the women. Like we have this whole thing that's going on right now where we're trying to push PrEP onto Black women because Black women actually have the highest HIV incidence rate for women. I also didn't say that we do. The rates are very high for Black women. And the most common mode of transmission is getting it from having sex with a man. So it's a lot of heterosexual women out here that have HIV. But how do we prevent that? PrEP. Like, we have the medication, we have the information, we have the resources, but how do we get Black women to actually take PrEP? So that's also a conversation that we have often.
I want to share this too. I don't want everybody to leave this meeting thinking that there's no heterosexual men out here catching HIV. I know several heterosexual men who have never let a man touch them who get that virus. So HIV isn't a down low virus. It isn't a gay virus. It's a virus that anybody can come into contact with. And one thing I want to share is that at our agency, anybody who wants to get on PrEP, we have a program that's funded by the state and the government and CDC to where you can get that medication for free as well.
All right. I think I ran through all the comments and the questions in the chat. Does anyone else have any questions that they want to ask? Doesn't look like there is any. The last one that I will have for you two is, like, what will be a charge for us to go into our community and be able to, how do we raise awareness and continue the conversation after this? And after having these type of programs, what can we do ourselves?
So I think you guys have a unique standpoint. You have an organization that, clearly health is very important to you guys. So just having more events like this where you get organizations to speak about what they do and bringing services into those communities. So we do a lot of community outreach. I said we go to JCSU, we test there. We go to UNC Charlotte, we test there. So just maybe partnering with people like Rayo to, have some type of, HIV testing drive, So just keep the conversation up, have testing events, condom distribution. We do condom distribution, so we can always give you guys condoms to give away to people. Who knows, whenever you have an event, you just never know. And also the education piece is very important. So this information needs to be passed on to the younger generation, because the chart that I showed you guys, the biggest demographic that have an issue with that specifically other than Black people is the ages between 20 and 24. I know a lot of people have, cousins, kids, aunties, sisters. Just making sure that we continue having that conversation, even if it's kind of just like, hey, like, let's go get tested together, like me and my sister, let's just go get tested together, like just making it more common for us to do that, even though it's kind of like, why are you going to get tested? But, just my sister's 16. So got to start those things early, like just making the conversation, just having the conversation in person and, doing the work. So making sure people are staying tested, make sure they have these resources and that you partner with people in the community.
I agree. And you can vaccinate your kids. I know that a lot of people may be against vaccinations and things of that nature, but at the age of 13, you can get your kids vaccinated for HPV. At that time, things are starting to wake up. They're going to start doing things behind your back, even if they don't fully engage in sexual activity. Have these difficult conversations. It starts in the house and then in your social networks, okay, your sexual networks. And beyond that, a lot of us are stigmatized when it comes to our faith and religion. And everything's taboo, and there's a heavy finger being pointed at somebody who defies the law of God and does a homosexual act or something like that. And just be supportive and loving and kind to those people, because we know, y'all know who is leaning to this way or that way. I mean, it's not a big secret. Love on them, empower them, give them the information and the tools that they can use and need to make a self-informed decision to walk into a place like Rail Community Health, where they can access these services for free, get on the PrEP or get the injection, and then they will live a long, healthy, and productive life. And in the end, they're going to love and thank you for having that intimate moment with them and being there for them. Because I mean, it's a very dark and lonely place for a lot of people who get shunned to the streets and start making some poor decisions and end up, having to take a pill for the rest of their life because they were rejected by their friends, family, and the church.
Okay, well, I really do thank you all, Kiara and San Juan and Rayo Health Community Health Center. I do appreciate you guys spending your Friday evening with us. Lots of valuable information that you guys provided to us. And I know for myself, I will continue the conversation. I actually normally for World AIDS Day, I normally take an at-home test and record myself just to try to start the conversation with many people. I did not do it this year. The day just came by so fast. But I do try to start a conversation amongst my friends and my family. But so if I know I get mine from Walgreens. So if you guys want an at-home test, if they are at Walgreens, I think they were like $45 the last time I purchased one, and it literally takes about 20 minutes for you to get your results. I do the steps and then I go clean up a room or something, then I come back and then I have my test. And I'm not taking it because I think something is happening. I'm just taking it just to start the conversation because I'm connected to so many different people and I don't know who's doing what. So if we can just start the conversation in our networks, I think that will be a bigger piece on how we can reduce the rates and reduce the stigma of it being a bad thing per se.
Stop
So,
wasting your money and go to the health department or come see us and get that test for free.
well,
You can get
I
an
didn't
at-home
know.
test
I
for
know
free.
now. I
Yeah.
know now. I will be coming over there and getting
Okay.
my free test now.
The health
But we,
department be
as an
even more.
organization, we will make sure that at our events, some of our community events, we'll make sure that we probably connect with you guys and partner to try to have free testing events at some of our community events going forward. So we'll make sure that we are doing our job as an organization to make sure that we are spreading good information rather than opinions about whatever we know.
Shondell says she want her gift card.
I was about to say we got a Target and a Walmart option too. Get you something nice out of Target.
Yeah, I because you guys joined, I now know where I can go and get my free test instead of going to Walgreens and paying that $45. So yeah, and I encourage everybody to go ahead and go and get their free test. And I know it's important to just know your status for not just for you, but for your kids and for your family. And then if you know someone that may have that illness or anything, you can have that conversation with them rather it being something that you're scared to start talking about. So
Hey, and let me share this and love on them. Don't make them feel like they're the lowest person on the totem pole or this nasty. They made a mistake. Anybody, if you ever contacted an STI infection in your entire life, you have no right whatsoever to discriminate somebody else because they caught something different from you. And those people need love done just as even more, to be honest with you. And like you're educated now, you equals you. They're virally suppressed. You can be with somebody who's living with HIV and not contract the virus because they're virally suppressed. And you have options. You can still get on PrEP. You can use protection and be with that person and be safe and live happily ever after. You never know. You might pass up the best king that would ever walk into your life. But to each their own. Some people
you
ain't
are
ready for
correct
this.
about that. But again, thank you. You all have a great evening, and I bid you all farewell and enjoy the rest of your weekend.
Thank you.
Thank you guys.
Bye.